The biceps brachii is a muscle located in the upper arm between the shoulder and the elbow. It is one of the most prominent muscles of the arm and plays a key role in movements involving the elbow and shoulder. Key functions of the biceps brachii are flexion of the elbow, it helps in bending the arm at the elbow, supination of the forearm, it assists in rotating the forearm so that the palm faces upward, flexion of the shoulder, it can also help in raising the arm at the shoulder joint. The biceps brachii has two heads, one short head, originates from the scapula, two long head. Runs through the shoulder joint and attaches to the scapula. The flexor muscles of the forearm are a group of muscles located on the anterior side of the forearm. These muscles are primarily responsible for flexing the fingers and the wrist, meaning they allow you to bend your wrist and close your fingers into a fist. Major flexor muscles of the forearm, 1 flexor carpi radialis flexes the wrist and helps in abduction, moving the hand away from the midline. 2 flexor carpi ulnaris flexes the wrist and assists in adduction, moving the hand toward the midline. 3 flexor digitorum superficialis flexes the middle phalanges of the fingers. 4 flexor digitorum profundus flexes the distal phalanges of the fingers. 5 flexor pollicis longus flexes the thumb. 6 palmaris longus helps in wrist flexion, though it's absent in some people. These muscles play an important role in everyday actions like gripping, lifting, and typing. They work in opposition to the extensor muscles, which extend the wrist and fingers. The abductor pollicis brevis is a small muscle located in the hand. It plays a key role in the movement of the thumb. Specifically, it is responsible for abducting the thumb, meaning it helps move the thumb away from the palm, enabling you to grasp and manipulate objects. This muscle is one of the thenar muscles, which are the muscles of the thumb's base. The abductor pollicis brevis contributes to fine motor movements of the hand and is innervated by the median nerve. It attaches from the scaphoid and trapezium bones, small wrist bones, and inserts into the base of the proximal phalanx of the thumb. The deltoid muscle is a large, triangular muscle that covers the shoulder joint and gives the shoulder its rounded shape. It consists of 3 distinct parts, or heads, each responsible for different movements. 1. Anterior, front, head. This part helps with shoulder flexion, raising the arm forward, and internal rotation of the arm. 2. Lateral, middle, head. This part is primarily responsible for shoulder abduction, which is raising the arm away from the body to the side. 3. Posterior, back, head. This part helps with shoulder extension, moving the arm backward, and external rotation of the arm. The deltoid muscle plays a crucial role in many upper body movements and is important for lifting, pushing, and stabilizing the shoulder joint. It is commonly targeted in strength training exercises like shoulder presses and lateral raises. The triceps brachii is a large muscle located on the back of the upper arm. Its primary function is to extend the elbow joint, meaning it straightens the arm. The triceps muscle consists of 3 heads, hence the name, triceps, 1, long head. This part originates from the scapula, shoulder blade, and contributes to shoulder extension as well as elbow extension. 2. Lateral head, located on the outer side of the arm. This head primarily helps with elbow extension, especially during movements involving force. 3. Medial head, found on the inner side of the arm. It is responsible for more precise and controlled movements of elbow extension. The triceps muscle works as the opposing muscle to the biceps brachii, and it's crucial for activities that involve pushing or straightening the arm, such as in pushing exercises, push-ups, bench presses. The extensor muscles of the forearm are a group of muscles primarily responsible for extending, straightening, the wrist, fingers, and thumb. They are located on the posterior, back, side of the forearm and originate mainly from the lateral epicondyle of the humerus. These muscles are involved in movements such as opening the hand, straightening the fingers, and extending the wrist backward. The major extensor muscles of the forearm include 1. Extensor carpi radialis longus, extends and abducts the wrist. 2. Extensor carpi radialis brevis, extends and abducts the wrist. 3. Extensor carpi ulnaris, extends and adducts the wrist. 4. Extensor digitorum, extends the fingers, except the thumb. 5. Extensor digiti minimi, extends the little finger. 6. Extensor indicis, extends the index finger. 7. Extensor pollicis longus, extends the thumb. 8. Extensor pollicis brevis, extends the thumb. 9. Abductor pollicis longus, abducts and extends the thumb. These muscles are innervated primarily by the radial nerve and play a key role in hand and wrist functions.